Dedicated community members and medical professionals could be setting a national example. Skylar?
Earlier this year, the Upper Peninsula lost its only in-person access to abortion care when the Marquette's Planned Parenthood clinic closed. What's now replacing it might be the first of its kind.
And that is the offering of medical abortion services through an urgent care clinic.
We created a system to deliver abortions out of an urgent care, which has never been done before in the country, as far as we know.
Local emergency room Dr. Victoria Cascanoja is the new provider working out of the Marquette Medical Urgent Care. Cascanoja said she had a history with the urgent care owner, but also that there are only 2 people part of a larger effort.
When Planned Parenthood closed, our community had these gaps in care in terms of medication abortion, and so we knew as a community we needed to do something. It has been a huge community effort.
While the return of medical abortion services may be the most notable effort of theirs, Dr. Cascanoja said the group is trying to go beyond that, hoping to offer things like low-cost contraception, HIV PrEP, gender-affirming care, all the things Planned Parenthood may now only offer over the phone or in a clinic hours away.
And the only reason we focused on medication abortion to begin with was because that was the one thing you could get nowhere else in the UP, but we have so many other things that we need.
The effort has been so novel that Attorney General Dana Nessel made a point to sit down with the organizers to learn about how they did it and what challenges they face. One of the biggest and the likely reason other urgent care clinics nationwide don't offer the service was the astronomical quote they were given for malpractice insurance.
We had to get a special rider, and they wanted to make it $60,000, and that was going to be untenable for us.
Luckily for them, that wasn't the end of the story.
We thankfully had an insurance agent win the bat for us and took the evidence to our carrier and said, show me on paper why you're charging this much. And when they looked at the evidence, they actually knocked it down to, $6,000 a year.
Nessel said back in Lansing she would talk to other state leaders about what could possibly be done to make that lower insurance rate available to other providers wanting to offer the service.
You can have all the constitutional rights in the world, but if you don't have actual access, then none of that matters, you know?
Cascanoja also said she's heard from doctors practicing in emergency rooms around the country about their desire to be able to offer medical abortions, but that they also hesitate to approach their managers about it. If the insurance became cheaper, she says, it might make those conversations easier.
What these folks have done here in Marquette has been, really impressive. And, let's see what we can do to help them as much as possible.
In Marquette, I'm Skylar Perkins from IUP News.
All right, thank you, Skylar. And a strange detail here with this story, an interesting twist. If you are searching through Planned Parenthood's website for abortion services, it may instruct you to seek care hours away as the organization works towards cooperating to inform patients in what is often considered a healthcare desert. We will keep you posted. For Urgent Care's website, you can visit our website, myupnow.com.